So thank you, the organizing committee, for giving me a chance to speak on this topic. Very good afternoon to everyone and to the moderators and chairpersons. So the topic I'm going to speak about is the current scenario of robotics in GI, HPB and liver transplantation surgery. And we'll be just going through the theoretical aspects in the beginning and followed by the practical applications. So the basically robotic enhances the it is an enhancement of the minimal invasive surgical era that is currently going into the trends with its 3D vision, precision and ergonomics. In the GI system, it is now widely used in GI and HPB surgery, and in the liver transplantation, it has been started, and it's quietly creating a small revolution regarding the donor hepatectomies. So as we know, the evolution of surgery, initially there was open surgical technique where the surgeons used to open the abdomen, do a laparotomy and do the surgeries. Followed by there was an era of laparoscopy. It was the first laparoscopic surgery was done by actually a gynecologist. He did an appendicectomy and a cholecystectomy. Followed by the robotic surgery. So as we have evolved with the technology as well as with the era of research, and a lot of work has been done in this department, the systems have kept on minimizing to the extent of the beneficial to the patient. From a big scar, we have come along with the small 5 mm holes, and I think progressively it may happen that we might even go for a very small minuscule surgical scars. So the key features of robotics as compared to other laparoscopic surgeries is the 3D HD vision. Although the newer laparoscopic systems have the 3D HD vision, but the robotics gives them a live visual experience in this in the patients. More so the tremors which are present in the especially in the older surgeons, they do get filtrated, and there are various systems to filtrate the tremors in the patient in the surgical system. Moreover, the instruments are very well articulated. The pain caused by a surgical instrument is quite less as compared to in robotic as compared to laparoscopy because of the horizontal articulations, and there is a motion scaling where the motion artifacts which are present in the laparoscopic system, and also the camera which is being taken care of the assistant by the assistant is automatically operated in the robotic, is in the control of the surgeons basically. So as I mentioned, as compared to robotics versus laparoscopy, we have all the advantages except the higher cost, because the instruments are disposable. They are one-time usage instruments. However, the robot which we are using at the Health One, that is the SSI Mantra, it is a made in India robot, and the instrument can be used into multiple times in the surgeries. So that is an advantage of the Indian robot as compared to the robot that is widely available. There is the Da Vinci system, which is an foreign robotic system. So recently robotics have been applied to the liver transplant surgery as well, more so in the system in the centers of Delhi, Medanta and Max and Fortis, where they have started doing a lot of donor hepatectomies. Because of the enhanced vision, the vessels are easily available, easily visible, and as a result of this, the transaction margins have been comparably compared to the open system. It has been quite easily visualized the margins and easily cut, and so the donors have been successfully done in the quite a few centers. Although the research in this field is still going on, the data that is emerging is very promising at present, and we also intend to integrate into our system. Last month only we have done a living donor liver transplant, and our patient is doing fine. So we plan to slowly and steadily integrate this robotic system into our donor hepatectomies as well. So as I said, there is a small incisions, less pain. However, the recovery portion is quite good, and the anastomosis are quite precision as compared to the laparoscopy, because the instruments have a motility in with the 9 degrees of freedom. So you can properly do a bowel to end-to-end anastomosis as well as vascular anastomosis because of the enhanced vision in it. Although the cost is still a limiting factor in the country like us, but I think we are getting there slowly and steadily. We are cutting down on the cost, and in the coming days it will be available to each and every centers in India, we hope so. The learning curve is quite longer, but as a surgeon, when you do a surgery, when you learn an open surgery, laparoscopic surgery, you know the basic anatomies. So within few months of training, I think it is easy to capture and conquer this robotic system. So as I said, there is rapid adoption in tertiary centers in India, and the robotic programs are going quite well. And with the help of AI, we can plan surgery, we can plan incisions, we can locate the tumors as well, and which helps in enhancing the outcomes of these patients. More so, robotics have been now used in the cancer surgeries, which we also do, and the outcomes are comparable to the laparoscopic as well as the open surgeries. So as I said, it is the target is to do an autonomous surgery, but I don't think so surgeons will become obsolete. You will require a surgeon to operate a robot. Robot cannot do a surgery on its own, and we'll look at the myths and we could debunk those myths that are there in this surgery. So we'll look at the practical aspects and what are the myths about the robotic surgery. So first myth is robot performs surgery on its own. So no, this is the robot performing surgery. So this is a myth. It is the surgeon who performs the robot. It is the surgeon who performs the surgery. It is the surgeon there. It is basically a robot assisted surgery. Robot is just a tool in the armamentarium of a surgeon, but the surgery has been performed by the surgeon. So I'll just guide you through the setup. So I am performing a robotic surgery with my 3D enhanced goggles, and this is the robotic arms. As you can see, it is the surgery has been done by a surgeon, and the robotic arms are continuously doing their job. So in a nutshell, we can say it is quite an advanced form of laparoscopic system where because of excellent precision, excellent vision, we are able to do finest form of surgeries as much as cleanly as possible with better outcomes. Second, it is more dangerous. No, it is very comparable and safer in many cases. And I would like to tell you that in last month, we have been the first center to do an emergency life-saving robotic surgery where we stopped the bleeding as well as we did an enteric perforation closure in that patient. So yes, the efficacy and safety is in the hands of the surgeon. Until now, no such mishaps have been reported. So it is the safety is quite comparable. So yes, myth 3, no complications. No complications do exist in any surgery, whether a small lipoma excision or to a sebaceous cyst excision to a large Whipple surgery. There are the chances of complication that can occur in any form of surgeries, whether you do it in open manner, whether you do it in a robotic manner, as well as you do it in laparoscopic manner. So myth 4 is just an expensive gimmick only for the rich, not for the poor. No, that there is a myth. Now the robotic systems have been integrated in the medical colleges as well. One of the centers where I had studied, it was a medical college, and we were given the license to use the robotic there as well. And the benefits outweigh the risks. So hence it can be used in each and every class of the society irrespective of the cost. It is same as laparoscopy. No, the vision is highly better. The movements are 360 degrees. The ergonomically, it is very convenient to the surgeon as well. We sit and operate rather than we'll stand and operate. Secondly, the tremors are filtrated. The long-term time surgeries where supposing we are doing a liver transplant or a pancreas transplant or a Whipple surgery, which are around 8 to 10 hours of surgery. So that is convenient for the surgeons as well. There is less tiresome and with good results. So it is easy to learn. No, as with any surgery, with our curriculum, the surgery requires intensive training and experience to use it safely and precisely and effectively in a good manner. It will represent surgeon. As you can see, it is the surgeon who operates. Robot only assists in the surgery. Rather, robotic instruments or robotic arms assist in the surgery. So surgeon remains still at the center stage. There is not going to be any time sooner where the surgeon will be replaced by a robot. That is very difficult, and I don't see it coming in the future. So telerobotics. So this is this is a good thing that has come in the reality existence, where certain remote centers where the robotic systems is the surgeon, if the particular patient needs to be get operated by a surgeon with a good expertise, as in certain hospitals in the West Bengal or Assam or Tripura, where recently we had also started doing a telerobotic surgery, and we did a robotic cholecystectomy on those patients, where I was there in a center in the Ahmedabad, and I could do the surgery sitting here into the hospital in Tripura. So this also helps, although it is still, the efficacy and safety are still yet to be ascertained with the data, but I think it's a good start to give good surgical exposure in the remote areas of our country as well as in the different parts of the world, where recently a surgeon in the China operated a patient in Uzbekistan and he did a liver resection. So I think it is an outward reach towards the places where the surgical expertise from a certain surgeon is not available. So robotics is a tool which enhances surgical precision, and it is not replacing the surgeon. And thank you everyone. Thank you for your time. Thank you.